All right, welcome back to Dr. Moses' YouTube channel. On today's episode, we want to continue our topic on acute back pain. And today we want to really talk about if systemic steroids actually help with acute back pain. Let's dive into it. Most of the time, people have back pain, and we can categorize the back pain into three. Number one, acute back pain with radiculopathy. That means you have numbness besides the pain you have in your low back, you have numbness radiating to the back of your leg, and also sometimes with tingling. Okay, so we call that acute back pain with radiculopathy. Then the second one is acute back pain without radiculopathy. That means you only have back pain, your back hurts, and you can bend down, but there is no numbness or radiating of the pain down your legs. And the third one is we call spinal stenosis, where there is a narrowing of the spinal canal due to various factors like growth of spurs or thickened ligament or sometimes disc degeneration that can also cause acute back pain. And so most of the time when people have acute back pain with radiculopathy, this is usually caused by disc herniation or degenerative disc disease, or sometimes, like I said, spinal stenosis or trauma. When you lift up something heavy, then all of a sudden you go ouch in your back and there's radiating of the pain down your legs, and that can also cause acute back pain with radiculopathy. Or just postural factor, because you sit down for a long time or because you are not moving, you are just kind of living a sedentary lifestyle and just sitting down, and sometimes that can cause acute back pain with radiculopathy. And most of the time when people have back pain, they go to the urgent care or they go to their primary care doctor's office, and most of the time they are given steroids. And so today what I want to discuss with you, we want to look at the trials that has been done regarding steroids with acute back pain with radiculopathy, without radiculopathy, and also with spinal stenosis. There are two big trials that has been done so far. There are other trials going on, but the two big ones. The first one was a randomized, double-blind, placebo clinical control trial that was done between 2008 and to 2013 in a very integrated healthcare system. And what they did was that they gave steroids, prednisone or oral steroids, to patients who had acute back pain with radiculopathy, and then they gave the other group just placebo. And what they found out was that the conclusion was that people who had radiculopathy, when they gave them steroids for a very short period of time, up to 5 days or so, they had a short-term relief from the pain. The pain was a little minimally controlled, but in the long term, their functional capacity had improved. That the long-term goal, that's by returning to work or whatever they were doing before. And also, what they realized was that taking of steroids will not prevent you from having surgery if you had like a disc herniation or something of the sort. Okay, and then they also found out about side effects to the medications, and they realized there are people who took the steroid for short term did not have any significant side effect. However, if you took the steroid for a long period of time, like people can be on steroid for like 21 days and sometimes even 30 days, those are very, very dangerous, because you could have significant side effects to steroids, such as high blood sugar, and sometimes even people can have actually black clot taking steroids. Okay, so if you do have back pain with radiculopathy, then you can get a little benefit from the short course of oral steroids. Now, what about people without radiculopathy? Well, the studies show that they could not actually have any relief, taking steroids, and whether the short term or the long term. Instead, they have more side effect. And so was that first study with people with spinal stenosis did not get any benefit using steroids. The second trial was done by Cochrane Review, and you can find this on the Cochrane site or PubMed, PubMed. You can find a study there where they also they did a randomized controlled trial, and what they were looking was pain control and long-term function on this patient, or the need for surgery or serious side effect. And again, they gave steroids to people with radiculopathy, back pain with radiculopathy, and then those without radiculopathy, and then people with spinal stenosis. And again, the conclusion was that there was a small pain relief from a short-term steroids, and also their functional capacity had improved for the long term, so they were able to return to work. However, it did not prevent them from having surgery. So the take home is that, and again, this study also concluded that people with non-radicular pain, that is, they don't have any numbness or radiating of the pain down their legs, or people with spinal stenosis, there was no benefit on taking steroids. So the take home is that if you have a back pain and you have no radiculopathy, steroids are not beneficial. Instead, you have more side effects. I hope this video is helpful to you and those having back pain. You can leave me a comment, give me a like, and subscribe to my channel, and I'll bring you such information on very common medical conditions and the proof if there is a trial, if there is a clinical evidence or not. So share this video with your friends. And also, if you have experience with back pain and you have steroids and it did work for you or it did not work, you can leave your comment below also for our viewers to learn something from it. Until then, I say stay well, and I'll see you again on the next video.